If you have a family history of macular degeneration, have been diagnosed with the disease, or are considered at risk, you may know that there is currently no cure for the disease. However, did you know that you can prevent the progression of macular degeneration with a simple, effective option available in the form of a nutritional supplement? Your eye care specialist may have discussed the National Eye Institute's age-related eye disease study with you, referred to as ARIDS. The study contains evidence that nutritional supplements can help treat macular degeneration. Over the years, additional studies have been conducted and the ARIDS 1 recommendations have been modified based on the most current scientific research and evidence. PRN, in collaboration with one of the country's leading eye care specialists, Dr. Mitchell Fineman, formulated 2 nutritional supplements to treat macular degeneration. The Macular Benefits Package from PRN includes the Macular Vitamin Benefit and Eye Omega Advantage. These supplements have been formulated to contain the safest and most effective nutrients for addressing macular degeneration. Here is Dr. Mitchell Fineman to explain why he recommends PRN's Macular Benefits Package to his patients.
My name is Mitchell Fineman, and I'm an ophthalmologist at Wills Eye Institute in Philadelphia. As a retina specialist, I see many patients suffering from macular degeneration on a daily basis. The hallmark of dry macular degeneration are waste deposits from the photoreceptors, the rods and cones, that accumulate under the retina, and we call these drusen. Over time, the drusen accumulate and damage the photoreceptors, causing decreased vision. When dry macular degeneration progresses, it develops into wet macular degeneration. In contrast to the dry macular degeneration, wet macular degeneration is much more aggressive and without treatment will rapidly lead to complete loss of vision in the eye. For dry macular degeneration, the treatments have been very limited. The ARIDS 1 study is the basis for most of the products on the market today. That study looked at antioxidants and zinc as a treatment for dry macular degeneration. And to this day, most of the products available use the ARIDS formula. The problem with the current formulas on the market is they do not take into account recent scientific advances showing benefit to other additional nutrients and supplements for macular degeneration. In addition, the ARIDS formula contains high doses of beta-carotene and vitamin E, and both of those have had issues with safety in patients who smoke or in patients with cardiovascular disease. Because of these issues, my colleagues and I sought out to develop a product that had none of the disadvantages but incorporated all of the new findings from the scientific literature in one simple-to-use product that's safe and it's third-party certified to be sure it's pure and has the correct potency. That product is the Macular Benefits Package. Now, the Macular Benefits Package is actually comprised of 2 separate supplements. The Macular Vitamin Benefit takes all of the positives from the ARIDS study but removes all of the negatives. In addition, we've incorporated the B-complex vitamins, which have been shown in subsequent studies to also be effective in preventing dry macular degeneration. The Eye Omega Advantage is based on the ARIDS 2 protocol, which is an ongoing study. This supplement contains high-quality omega-3 fish oil, in addition to lutein, zeaxanthin, and vitamin D3. All of those nutrients are thought to limit the progression of dry macular degeneration in patients at risk. One of the things that surprises me when I'm seeing patients on a daily basis is how many of them have already been recommended to use omega-3 supplementation by their internist or cardiologist. What I'm doing with this product is simply giving them a high-quality product in a very convenient dosing schedule. You may already be taking fish oil and have a sense that you're doing the right thing. And while this may be the case, many of the products available over the counter simply don't have the potency or the purity to be taken on a daily basis in a safe way. The combination of the Macular Vitamin Benefit and the Eye Omega Advantage seems like a lot, and for some it may seem very expensive. But as I explained to my patients, all of these nutrients work together in order to reduce the risk of macular degeneration. And I recommend using them as a supplemental package. If one were to go to the drugstore and try to purchase each of these supplements separately, you would find that the cost associated with doing that is much higher than taking the package from PRN. I recommend the Macular Benefits package to my patients because I would like to treat my patients as though I would a family member. If you have concerns regarding your individual risk for macular degeneration, I recommend that you have a full ocular examination, give a full family history, and speak to your doctor about whether the Macular Benefits package is right for you.
Eye care specialists rely on PRN's Macular Benefit Package to maintain the optimum macular health of their patients. Nutrition is important, especially to patients at risk for macular degeneration. Your eye care specialists can put you on the road to improved macular health with the Macular Benefit Package.